Hey guys, it's HINA here at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as on the main line in Narberth, Pennsylvania. And I am a orthopedic and pelvic floor physical therapist that treats with a holistic, kind of integrative, functional medicine kind of background to help treat a lot of complex spine, hip, and pelvic issues. And today I want to address something that I had a patient recently call and ask about, because I think some of you might be having the same questions if you're watching this video. So they basically said, you know, all of a sudden I've started developing this sharp pain in my back that kind of wakes me up in the morning, or it starts in the morning, and then it actually improves as the day goes on, and I feel better by nighttime, but then it comes right back in the morning. So, you know, I've gone to my primary doctor or family physician. They've done x-rays. They don't really see a whole lot going on. So they gave me some medications, muscle relaxers, and, you know, it improved. But as soon as I stopped the medication, my symptoms are starting to come back. And can you help me with this and what's going on? So again, if you're watching this video, this is more of an explanation video. I am going to talk about what things can help, but it's not going to be a demonstration video. Okay, so basically what is going on and what can you potentially do about it? So basically, first I got to talk about the spine. So the spine is made up of several vertebrae. And what vertebrae are is they're like blocks in your body, okay? So if you, I'm going to grab an image right over here, okay? If you basically peel off all of the muscles, take out all the organs and things like that for the body, you're kind of left with the skeletal structure. Now, there's some muscles still here. But basically, if you look back right over here, this is your spine. This is the back part, this is the front part, but this is that lumbar or the low back part of your spine. And they basically stack like blocks on top of each other, and those blocks can basically move. So again, if you look at the side of your spine, so here it is again, this is your vertebra or your spine, okay, and then it comes down here, and eventually you get the tailbone down here, okay? You see that these are kind of stacked on top of each other like blocks, okay? And these blocks basically move on top of each other, and this is what's known as your joints or your low back joints. So oftentimes, sometimes that sharp pain could be coming from these joints that are kind of stacked on top of each other. But these bones are also held together by tissue. Otherwise, if there wasn't any tissues that was holding these guys together, then, you know, the blocks would just fall over. So that tissue is called ligaments. So they're not shown here on this photo right over here, but you basically have ligaments that stabilize or secure these blocks in place, but they're not so sturdy that they can't move, okay? So there's some nice shifting that happens in between those joints. And then on top of those joints are muscles. And that's what basically you normally think about when you think of your back muscles, is you've got all these muscles that basically layer on top of your back in various different layers. So you've got a deep layer, you've got what's called an intermediate or a middle layer, and you've got an outer layer of musculature on top. Now, sharp pain can be coming from the joint because it's either moving too much or it's moving too little. And that, just from that, it can cause irritation within the joint. And then that can cause even partially some of the ligaments, okay? Those are the tissue that holds those blocks together to become irritated. And then on top, when that's irritated, it can also get those muscles to become spasmed, okay? So when you think of this sharp pain in your back, sometimes, yes, it could be just coming from the muscle, or it could just be coming from the joint, but it could be a combination of all three of those things. And we often see that in our clinic, that it's sometimes not the joint. So just going in and possibly having some chiropractic adjustments, maybe it'll give you temporary relief, but it may not give you full relief because there's still these ligaments that might be irritated, or the musculature on top. Now, I've also heard that some people say, well, I went and had massage therapy, and I went and had chiropractic, and, I had some strengthening exercises as well. Maybe I've already gone to physical therapy and they did some strengthening. Well, if you had a lot of these things and it seems like it gave you some relief, but not full relief, or maybe it didn't give you relief at all, or maybe it did give you full relief for a temporary period of time, but then it started to come back, well, you have to understand the back works not just with the back muscles, but it works with a bunch of other muscles as well. And I'm going to go back to this picture right over here to show you. Here's your low back, okay? But there is a bunch of other muscles that connect on deep inside to your spine. And some of them, this right here, okay, is your diaphragm. It's actually the muscle that you breathe with. And then you've got other deeper muscles further inside. Okay, I'm going to go back to my first photo over here that also connect up onto the spine. So there's that diaphragm again, and you can see it's got little connections there. But then you've got other muscles that actually start in the back and they dive deep down in the front. And that could be influencing and causing issues in your back, okay? And there's several other muscles. So these are just two I'm going to point out. But know that there's many other muscles that could be problematic that is creating the spasming in your back. So sometimes you have to not only address the back, but you have to address other muscles that are also attached on to the spine. And oftentimes what we find, at least when in our clinic, is sometimes we're treating the rib cage, sometimes we're treating the hip, sometimes we're treating the pelvis, sometimes we're treating deeper inside the pelvis, sometimes we're even going all the way up to head and neck sometimes to balance a lot of these muscles out. Because once the muscles are balanced out, then it takes the stress off of the ligaments. Remember, those are the tissues that connect those blocks together. And when the stress comes off of the ligaments, because, you know, if they feel like they have to work a lot, then they're going to get irritated. But once they don't have to work as much, then it takes the stress off of the joint, okay, which is where your problem may be coming from. But it's because of potentially these imbalances between a lot of the musculature and possibly a stiff joint or a joint that moves too much. So sometimes you need a combination of working on some of these muscles. You might need that strengthening, but you might need some stretching, but you may need release work of a lot of these different muscles. And the combination of release work of these muscles, combination of addressing a lot of the, you know, the rib cage, the pelvis, the hip, all of these things, other muscles that have connections onto the spine, or maybe sometimes even indirect connections onto the spine, may just help balance the whole system, okay? System meaning the whole, you know, your whole musculoskeletal system, meaning your bones and your muscles and the fascia in and around the trunk, okay? That then just calms everything down. And then you may notice that, hey, my pain's actually gone in the morning. And it's not due to that little arthritis that my physician found on the x-ray, or that little disc bulge, or even that moderate disc bulge that I saw on my MRI, or something else. Because in reality, you know, as you're kind of creeping into your late 30s, late 40s, you're gonna have changes in your spine. It's kind of like the normal wear and tear of a car. You use it, you're going to end up breaking certain things down. We're not all perfect. Some of us are, but we're not all perfect. So just realize, don't be scared from anything that you see on an x-ray or an MRI. These things could just be a big imbalance of a lot of these musculature, and that you just need to have that addressed. So I hope this video helps to kind of explain that. Maybe it calms some of those who are having some anxiety about their back pain, that there is help out there. It's just perhaps it's not being seen in this holistic kind of integrated way. And so, you know, if you live in and around the Philadelphia area or around the surrounding suburbs, or you can get to us or you want to see us, then great. Hop onto our website. It's rebalancept.com. That's REBALANCEPT.com. We have lots of other helpful YouTube videos that might help in conjunction with this video. Lots of other newsletters. You know, you can sign up for our newsletters or blogs. We're on Facebook. So look us up. We have lots of great tips and helpful information. And if you want to get treated by us, no brainer, come give us a call, and you may even qualify for a free consult if you are looking to have treatment with us. And so I hope that this video helps. And for all of you, have a wonderful day.